When it comes to all that, can aging in place be done? We have to consider multiple factors. We consider how many floors or changes in elevation are there. We consider, is the dwelling a garden apartment or a split floor plan? We look at the issues of exterior steps. Are there steps? And if there are steps, are there handrails for the individual to stabilize on as they ascend and descend? We look at how compact are the main areas of the house, and by that I mean how far is it from the kitchen to the bedroom and the bedroom to the bathroom, and if the bathroom has a tub or shower that the person can access. And finally, is this your forever home? So many times people will purchase a home or rent a space that they consider living in during their child rearing years and then know that they will move out of later on. To stay in your home, there are many simple and easy low-cost modifications that can facilitate safety. Things like lighting, hallways, and well-traveled areas should be very well lit because, again, many people as they age up have declining vision. And light switches also need to be easily accessible. So some homes are arranged where there's a light switch at the start of the hallway, but there's not another switch at the other end to turn it off or on. So if you're coming in the opposite direction, that would be challenging. But those things can be modified. We also look at the heights of furniture and the type of furniture that's in a place. Optimum height is that something is not too high and not too low, so that it's easy to get on and off of, and furniture type and placement. We don't want too much furniture because it would clutter the environment and make it more challenging for individuals to get around. We also look at where the furniture is placed so that there are big open spaces for mobility. We want to check that the furniture itself is in good condition so that there are no broken legs on chairs or tables so that it would reduce the risk of injury. Often we recommend to people that they remove scattered and area rugs because they can become a trip hazard. And we also think about widening doorways or adding grab bars for accessibility. On this slide, we see a couch that has no armrests in the middle of it. So if an individual needs to use their hands to push off and up from a chair, you want to consider different seating arrangements. When we consider a bathroom and the ability to age in place, we want to look at, is the bathroom close to the bedroom and living room areas where the individual will be? We'll look at the entrance width of the doorway, and it would need to be a minimum of 24 to 30 inches for wheelchair accessibility, but it's more optimal to be 30 to 40 inches so that there's a little bit of space on both sides for someone to self-propel. We also want to make sure that in the bathroom itself, there's room to maneuver. So if a person needs to use their walker in a bathroom, can they get that walker in, turn it around, and get back out safely? We also look at tubs and showers. We look for ways to provide both accessible and comfortable bathing options. Walk-in tubs or showers are ideal. And walk-in showers means that there's no threshold for the person to step over. So if they're an ambulator, they don't have to step over anything and have the risk of falling. And if they use a wheelchair, they can get a shower chair that would just roll into place. Kitchen and dining considerations, again, staying healthy requires good, healthy eating. That we want to look at cooking tools and food items to keep them low enough to reach without a step stool, which is challenging for many people. We want to look at the accessible height of a counter. So accessible height means that if you need to be seated in a wheelchair or a chair to rest, the height of the counter should be about 34 inches to be able to prepare food. We want to, again, hope that the kitchen is both compact, because that it's easier for the person to get around if they're an ambulator, but if they're in a wheelchair, sometimes a little bit more space will allow wheelchair mobility. We look at the ease of opening and closing drawers so that they should be good sliders. We look at things like lightweight tools. Many people use different sort of mixers and handheld mixers. Some of the older ones are heavy, but there are many newer ones that are lightweight. We also like to make sure to prepare and cook in areas that have good lighting, again, so that individuals can see what they are doing to reduce risk of injury. Stairs and multi-level homes can be a challenge, but again, they can be made accessible if a person has the means and chooses not to move out. So if you have a multi-level home, some homes you can put in elevators, others you can add on a chairlift option. We look at stepping down into living rooms or split-level floor plans. Multiple small elevation changes can be challenging. Many places have a step-down living room and have no handrail. So again, depending on the situation, adaptations would be adding a handrail or ramping the step. When we look at entrance onto a porch or terraced area, again, we want to look at small and wide steps are best, and railings on both sides for the person to use to stabilize themselves and assist with balance challenges. New technologies that help monitor seniors are plentiful and continue to be developed. There are various systems. Some of the older ones that we're used to are a life alert system where the individual wears an alert on themselves that is set up to a base, and if they fall or need assistance, they can press the button on their life alert that will call the prearranged numbers in sequence, whether that's first to a family member, then sometimes if they're living in an apartment building, it may be downstairs to their main desk or to a super, and finally to 911. There are also many personal watches these days that have devices in them that can monitor fall risk and can have a GPS built in so that they can go out into the community. Life alert systems come in two versions, I should have said. One that's only in the home, and the second that does have a GPS again that can be used when someone goes out into the community. There are also cameras that can be set up in an individual's home that has a transmittal to the patient's family that they can kind of monitor their family member from a distance. On the bottom, you see a woman getting out of bed with what looks to be a rug underneath her feet, and that rug is actually a sensor so that when the individual puts their feet onto that rug, an alarm goes off, letting another individual in the home know that they're getting up so that they can yet have their independence, but someone can come over and walk them to the bathroom safely or wherever they want to go. When we age in place, we also want to consider various means in the community. We may have to look at in-home caregivers, which can often support families if they live with the individual and need to go to work. A caregiver during the hours someone is working is helpful, or if a family lives far enough away that they can't be there all the time, again, a caregiver can assist. Home support costs are much less than a nursing home, so again, many families worry about the cost of hiring a caregiver. Depending on someone's insurance, there is sometimes some assistance from insurance for caregivers. Some people have taken out long-term care insurance that support caregivers, and in either case, it is still cheaper than going to the nursing home. Also, if someone's unable to prepare meals at home, then things like Meals on Wheels or other organizations like God's Love We Deliver can support the person by dropping off several meals at a time and enabling them to have good nutrition throughout the week. The other thing that's nice about if someone requires meals is that it's another individual coming to their home or apartment that kind of is a check-in that they're okay. And the last thing we would look at again is transportation services, such as Accessoride, which is a funded situation that people have to apply for, go down and be evaluated for, and then if they qualify, Accessoride can be set up where the person gets picked up and brought to medical appointments, to family members' homes for holidays, or to any other adult day center. When we talk about being able to stay at home, another consideration, again, are the socioeconomic barriers to staying at home and aging in place. And these are not just based on income, but also educational attainment, financial security, subjective perceptions of social status and social class. And it's interesting to note that about 14.5% of older adults live below official poverty levels. So when we talk about, again, socioeconomic means and being able to age in place, individuals 6 years older with low socioeconomic status who self-reported feeling lonely were found to be at greater risk for functional decline. And a lot of what that is because they don't get out. 1 in 3 persons with a chronic illness, which can be anything from arthritis, diabetes, asthma, cancer, COPD, stroke, hypertension, coronary heart disease, or psychiatric issues, and low socioeconomic status are unable to afford food, prescribed medications, or both. So they need, again, to somehow be brought into the system and be evaluated by a social worker who can help them navigate the system and find supports so that indeed they can maintain adequate nutrition and take the medications to maintain their health. Considerations for going into an assisted living are: does the facility offer special care units, such as those serving people with Alzheimer's disease? So some assisted living have memory care units, others do not, and which one would be appropriate for any individual depends on their needs. You would want to also consider, can residents choose their own doctors, therapists, and pharmacies? Some are all-inclusive inside, and some allow personal choice. Other things to consider are under what condition would a resident have to leave the facility. I spoke earlier that if an individual is no longer ambulatory, they might have to leave the facility. Some facilities in the suburbs have it where the individual may be able to stay within their community but move to a different facility with more supportive care. And those situations are often desirable, where a couple would move into an assisted living. One of them then sustains some health issue that's requiring additional nursing support or caregiving, and so one may stay in the apartment that they started in, and one may move into a different building that's more skilled nursing. But yet they're able to visit each other back and forth because they're in the same community still. You also want to look at, does the facility specify all services provided by the facility, and or are there additional costs to it? So many assisted livings will provide assistance with medication management. However, often there is another cost associated with that. So you want to make sure you ask all those questions. You want to make sure if they standardly give you 2 hours a day of assistance for AM and PM care, dressing and bathing and washing up, and someone needs more, can you, again, hire that within, or do you have to go outside? And finally, you want to find out, if you're a pet owner, can you go into the assisted living with your pet? Do they allow cats, dogs, birds, etc.? Types of care a nursing home provides different and upgrade from assisted living or senior living situation is they will usually provide more extensive care for a person when they just get out of the hospital. Nursing homes offer help with custodial care, meaning bathing, dressing, eating, medication management, medical monitoring if they need their blood pressure or checked or their blood sugars checked. And it would also supply skilled care, include services such as trained professionals. It may include physical, occupational, speech therapy, and respiratory therapy as well. When you consider a nursing home, you consider a few more things. Does the nursing home provide the level of care the individual needs? If an individual has a respiratory status, does it have units for respiratory patients? Does it have units that supply oxygen or ventilators if need be? Does the nursing home meet local, state licensing requirements? Does the nursing home meet state fire regulations? What are their visiting hours? If you're an individual who works and your family members in a nursing home, can you get there and with what frequency to visit that individual? And what are the procedures for responding to a medical emergency? So at what level can they handle it in that nursing home, and at what level does the person need to be transported out to an emergency room? And if so, what facilities are near you, and is there a doctor at that facility or have some permission to practice there?